Yep, there you go. Whoa, that's gonna hurt. Oh, right in the eyes. No horsing around. I don't think they're gonna like each other, and I don't think this is going to end well. In honor of the new show coming out, The Ones Who Live, today we are breaking down and reacting to all of these zombified medical scenes and over-the-top injuries from The Walking Dead. Let's dive right in.
A herd's coming, bug out now!
Ooh.
Oh, Jesus. We gotta get the hell out of here.
Oh, no. Oh, that is the worst.
That's the worst.
The arm is trapped underneath, pretty much like immovable object. Two choices: somebody comes up with enough strength to get that log off you versus cutting off the arm.
Get the mules out here, you! Get over here right now!
Let's get it off there. The concern of that type of injury is a crush injury, so a fracture of the humerus, shoulder, maybe a dislocation, and then also the breakdown of the tissue itself. You worry about rhabdomyolysis.
Where's the dick?
He's gone, it's just me.
It's just you.
Ow. Hard to see, but it looks like it is all the way down to the bone and there's no other tissue there.
I have to amputate.
Why she says you gotta amputate, it's like how you gonna salvage that, where you're gonna get muscle, where you're gonna get tissue to cover over top of it. So in this situation, you just need to cut it off.
What? There ain't no other way?
The only way to stop the bleeding is to amputate and cauterize the wound. Here.
Wait.
From the elbow down, and they're putting a tourniquet above it to try to reduce the blood flow, but you can't cauterize the big major blood vessels. Maybe in the arm they won't be as big, but they're still going to be maybe just the size of your pinky or maybe a little bit smaller. You actually have to tie those off.
You got something for the pain?
It wouldn't kick in fast enough. We have to do this now.
Maybe the medications that they have there are only, say, like oral medications. So if you take an oral medications, it can take 30 to 45 minutes for it to actually kick in. Versus if we have it in IV or IM medications, usually a minute or two.
Oh, sorry, man.
Oh my gosh, like a blowtorch. You can heat up metal and then kind of touch it to those areas to cauterize it with a hot metal versus actually like a flamethrower.
I need you to hold him down for me.
Besides the pain of the injury, even putting a tourniquet on really tight hurts like hell. See the importance of books when you don't have the internet? The knife, saws. The saw actually is probably a lot better because of the teeth on it versus a knife that's just a straight blade. Of amputations that I've seen, it's usually a saw, maybe a wire saw versus a rigid saw. Oh, jeez. Oh. Oh, what is this, like concrete rebar? This could be straight through your spleen. This could be straight through the lower part of your lung, or it could be in the intestines right where it turns right there. The left side. The likelihood that it hit your kidney, it's a little bit too lateral. Definitely could have broken some bones of the ribs. That's probably where they're lower. Probably most likely lower lung or spleen. You can live without your spleen, but you know, you can't live if you're bleeding out on the inside. You stuck to this hard piece of concrete, rock. The only way to get out of the situation is to pull it out, so to speak. But the only way to do that is to lift yourself off that. So I don't think this individual's got a good chance. He's gonna try to pull himself up with the... Yep. Ah. Run.
Run, Forrest, run!
Wow, that is impressive. Now you're gonna deal with rust. Hopefully his tetanus shot's up to date. It's not necessarily the rust, it has to do with just the pathogen on these things. Well, at least the horse is hanging around. Woo! So you haven't bled out yet, you're just in a significant amount of pain, but pain prevents people from moving. If you can muster up the ability to tell your brain to keep moving, you can get out of this situation. Oh, wow, okay. Straight through the suboccipital. suboccipital, so back of the skull, into the mouth. If you're going with that blade, it's gonna most likely sever the brainstem, our basic autonomic nervous system. We're not gonna be able to have a normal function of our breathing apparatus or heart. I feel like all these characters need something called Chillax. One of my supplements. Definitely check it out for yourself. Something that'll nicely help and aid in stress. Oh, what the hell? Oh my gosh, they're just heads, they're still alive, that's crazy. But they're infected. Will the infection pass on? You got open wounds. Dirty water is the pathogen that's causing this in there. Let me know in the comments for all those Walking Dead buffs out there. Oh, get the glass, use it as a knife. You might cut your own hand, but potentially gonna save your life. Yep, there you go. Whoa, it's gonna hurt. Oh, right in the eyes. Not a lot of blood in the eyeball itself. It's mostly fluid, but there is blood to the back of the eye that's supplying the eyeball itself. So there could be some bleeding, but they always make it seem like there's a lot more blood going on. It's mostly fluid. Oh, and even smarter, snap it off. It depends on how far that piece of glass went in. Did it go just through the eye socket, not to the brain itself? Is it into the frontal lobe or into the temporal horn? So these two areas.
What the hell are you gonna do now, sport?
Stop it. They always say that biting through a bone or finger is like biting a carrot, but there's a human component that prevents you from doing that full bite. They're saying you're able to bite deep enough to hit the jugular vein, not super easily accessible. If you rip open the vessel itself, you're not going to go down that easy, that fast. You will bleed, but your first instinct is going to be to try to get it to stop. Just don't compress both sides because then you decrease flow out.
We get to come back.
Nope.
Liar.
Oh my gosh. It's a partial amputation or decapitation at this point, hitting the major blood vessels of the right side of the neck, including the carotid artery and the jugular vein. There's not much bleeding going on yet, and he's still aware because he's totally not decapitated and his spinal cord is intact. Oh, shot to the upper thigh. A lot of meat there. Hopefully it didn't hit any major blood vessels. Most of the time, by that point, the major blood vessels are trying to cruise behind the femur itself. Oh, see, he's still alive. Good job, whoever created this. Not totally bled out yet, and is still trying to survive. Nope. Now I change my tune. A lot of force. This blade needs to be pretty sharp. Maybe soft tissue, no problem if it's not the sharpest, but to cut through bone, it needs to be really sharp. But again, you can hack away for a while. Walking Dead, very interesting show. A lot of injuries, a lot of things to talk about, but it's so interesting because their medical care is so limited. It's really hard to take care of these injuries, and something super simple that we can fix nowadays with our modern medicine. If you guys enjoyed me reacting to Walking Dead, please let me know in the comments that you want me to do more. And as always, do me a favor, definitely check out this playlist right here, binge watch everything, and make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.